Hello, Dr. June, and thank you so much for joining us today on the Aesthetic Business Masters podcast. We're really excited to hear your thoughts on the double tight, and also I have to say that you did an amazing job presenting at Cosmeticon. It was a fantastic breakfast workshop, and I'm so glad that more people get to hear you now through this podcast who maybe didn't make it to Cosmeticon on the weekend. So please, I'd love for you to introduce yourself and tell us all a little bit about yourself.
Hello, everyone. This is Dr. Rhee from South Korea. Officially, I'm Dr. Rhee, but all of my friends in the world, they call me Dr. June. Even I was born in August, but they call me June. As I hope this is later, so you can easily and friendly call me June. I graduate my medical school in South Korea, and I do a clinical fellowship in University of Chicago in state for reconstructive. And then I'm back to the Korea and I study about anti-aging sports medicine. So I have such an experience to about beauty and also healthy. And and I'm pretty now is time to it, I believe it's myself it's time to focus on the develop and uh, manufacture to machine is quite a maybe a little my part of my job. So I trying to my best.
That's amazing. And I wanted to talk to you today about skin tightening, as this is an area that has always been very challenging in the
Uh-huh.
non-surgical space. So
Mhm.
please tell us what excites you most about the latest advancements in non-invasive skin tightening treatments today.
And most of those is I'm still doing the surgical things. But as a trend in the aesthetic field, this is a trend to become more into a non-invasive treatment and non-invasive treatment. Even the product company, even the machine company, they are focused to develop all the product or the machines for the non-invasive. Non-invasive treatment is most of all we can see more patients and the patient they can approach and they can come to the clinic more easily without hurdles. So non-invasive treatment is quite a more, I believe, it's more become a more bigger and a more developing area. So that's one of the reason I try to focus on the non-invasive treatment.
Absolutely. And for those who are unfamiliar with the double tight,
Mhm.
are you able to give us an understanding of what exactly this device is and how it compares to other devices in the industry?
Uh-huh. And before I using the double tide, it's just my uh, treatment is always is the treatment layer should be divided. For examples, in the from under the 4.5 millimeters, 4.5 millimeters under how we can treat, and from 2.0 millimeter to the under 4.5 millimeters how we can treat, and then from the skin surface into the below the 2 millimeters how we can treat. And I think this everybody have and very everybody happily use HIFU. HIFU can be very good option for maybe around between the 3.0 to 4.5 millimeters. HIFU can be the best options, but hypo is a little bit, I believe, is uncomfortable to treat over. I mean, from surface to the 3.0 millimeters, hypo can be familiar and maybe uncomfortable, doctor. And the agonist and my teams, my senior, Dr. On, and we discuss how we can make upper dummies improve, and then we try to read a paper and we do the research for the how we can make dummies tightening and dummies rejuvenations. And we study and we found a lot of papers and we found papillary dummies, especially located at zero point 0.3 millimeters. It's a papillary dummies. Its function is most important for the rejuvenation for the dummies skin condition. So we are try to focus how we can rejuvenate papillary dummies. That is most specific things in double tight.
So, am I correct in saying that all RF devices can rejuvenate from the papillary dermis, or is this something that's unique to double tight?
No. So all RF device they can rejuvenate the papillary dummies because they have energy levels, so they can choose the 0.3 and 0.4 and 0.5. But actually, in the before, the older machine they try to focus in deeper, and they will company they try to show that our radio frequency energy is quite a deeper penetrated into the skin. But we researched and we found papillary dummies quite has important function. So of course, other radio frequency machine they can treat the 0.3, but the double tight is a specific. We are quite strongly focused in 0.3 papillary dummies in rejuvenation.
And does that make it less painful than some other RF needling devices?
And most of us about pain, and we have three things. The first, needle. Yeah, because of needle, it is pain. And mild radio frequency can cause a pain. And second is patient's emotion can cause a pain. Mhm. So if the needle is quite long, for my experience, maybe over 1.0 millimeter longer, that needle cause more pain. So for examples, we have three kind of needles, only 0.3 needle and 0.8 plus 0.8 needle, and the 0.3 and 1.0 needles. In my clinic, I'm not sure since my patient is quite strong like me. So even though my patient without numb cream, they can do the only 0.3 millimeter radio frequency only treatment. So that means quite compared relatively quite painless.
Amazing. So you're obviously based in South Korea. So I'm assuming
Yeah.
that a lot of your clients have a more of an Asian skin type.
Mhm.
Um, that brings me to so who can have this treatment? What Fitzpatrick? Can anybody have the treatment or
Yes, it's actually the when we started the marketing the machines, so we promoted this is anti-aging or senolytic device. So aging means it's yeah, of course, it's from the middle age patient they can be a good candidate. And also, when we have to think about what is age. For example, sometimes we said photo aging. It means photo sun ray cause aging the skin. So that means it's not a biological age. So if the someone damaged from even the young age, even they expose high sun ray, that means their biological age is maybe 20, 25, but their skin age maybe 50 or 55, right? Because of the photo aging. So all the aging process is past the same pathological pathway. So we can treat patients quite broadly.
wow, that's incredible. Well, in Australia, we have a lot of
Yeah. It's just
phototherapy.
you know that my last visit was Australian 8 years ago. That's why I remember the Bondi Beach in the brunch and Nando's chicken. And then I found Australia is maybe if the Australian doctor asked me which indication is good for the double tights for the Australia, I definitely say neck. Mhm.
Yes, yes. Well, I think that's because we put sunscreen on our face and we forget everywhere else.
Yeah, right.
And you gave a really great analogy at Cosmeticon. Can you talk us through that?
Yes, and that's a papillary dummies. And then papillary dummies, they when they're young, they make a candelabra shape a lot fibroblast. So it's just a candelabra shape. So like a pork. So they hook in the epidermis. So that's why the younger patient's face is more cushionable and touchable. When they touch, it is more soft. But it become age, its candela shape is disappear. So that is one of the index our double tide treatment before and after. We do the pathological slide and we check up any change, and then we try to the how the candela shape is improved. And then that's why we can say our radio frequency machine can be one of the senolytic treatment.
And this candelier shape and analogy is how the double tite achieves skin tightening and lifting.
Yeah, this is first of all, this the you can believe this maybe it is not 100% back sure, but popular dummies is you can believe this kind of the factory for the new young skin cell, the fibrous blast and elastin and fibroblast. So the popular dummies is like factories. This is a factory become old. There's the product. This is a reduce and reduce. So we apply for the radio frequency target on the popular dummies, and we push and make more, make manufacture more product. So actually, this, when we young, the popular dummy is quite thick, and the reticular dummy is thick. But when we become old, the popular dummies is shallow and lose function, slowly lose function. And then the reticular dome is more longer. And then after we apply for the radio frequency, yeah, this factory, they manufacture more cell for the skin, and then they become thicker.
That's incredible. And can you walk us through, it sounds fantastic, but can you walk us through what a typical treatment session would be and what patients can expect? Is this something they need to do every week forever, or what would the normal patient journey be?
Sister, usually I do, especially the patient, they ask it about their because they worry about their skin condition, and they were about, oh, my skin is too dry, or sometimes too start to shag, and they my pore is a little bit become a bigger, and then my wrinkle is become more obvious, and then I explain, oh, this is a sign of your aging. So how about we do the anti-aging treatment? Of course, there are so many treatments. Uh-huh. So, but I start with because and the anti-aging treatment is base of the treatment, I believe. Even for example, even the fine wrinkle, yeah, we can do the botulinum toxin injection, but that's a temporal, and the base is still unsound. So I want to make it foundation is sound. That's why I do a skin treatment start from double tide radio frequency treatment, and usually 4 weeks interval. And I recommend 3 or 4 sessions.
Oh, okay. And will that give a noticeable result?
The first of all is I always ask the patients is the what you feel after first session, and uh, actually that's kind of the expression from women is the most women patient, the female patients, that when they finished got a first session, and then 2 weeks later they start say, oh, Dr. Jones, when I make up, they expression is it absorb more and it more the waste moisturize, and then they feel maybe after second session they can feel is improved, and then even the first after first session I always ask the patients, please when you wash your face please touch it, and then please tell me what you feel during the washing your face. And you know, it's kind of curious. It's a woman knows what is skin.
Absolutely. And
Yeah.
how long does that result normally last?
Uh, because this is quite a new machine, and I start using the double tides more than 1.5 years. My first part of the patients, they got a 3 session and they didn't come back yet. And also they didn't complain. That means yeah, it is more than lasting more than 1.5 years. I believe maybe that part of this year, the patient will come back and then I will do some boost 1 session again. Maybe
Yeah.
1.5 years is rest.
Yes, yeah.
Mhm.
Amazing. And I mean, goodness, I'm sure you've had invested in lots of different devices over the
Mhm.
years and seen a lot of devices come and go.
Uh-huh.
How important is it when you are choosing and investing in a device for your clinic?
Okay, sister. I run my clinics by myself since around the 15 years, and luckily, I'm very lucky and quite successful. So, the as a senior, and I invest money for the device, but I will always give my advice to junior doctors who start the first aesthetic clinics. I always recommend them don't invest too much money. Don't try buy every machines. Just to buy machine is good for ROI, return of the investment, quicker because of some machine, yeah, of course, is some machine is one of machine I'm thinking about buy this quite expensive, more than $200,000. Yeah, but it would take quite a long time the return of investment. So but for the young doctors, it's quite a hard time to wait. So
Yes.
I always ask the young doctors, please compare all the machines and then just think about your situations and don't try everything as pigmentation treatments. Is just a focus target you want to try and then get a one good reasonable price machine and invest. And also, I advising doctors is always if we using the our knowledge. For example, so double tide, we focus on the zero point 0.3 millimeter depth papillary dummies rejuvenations. So if the doctor, before they invest the money to buy a double tide, how about they treat the marola 0.5, 0.4, and then they will see, wow, its depth is right. And then if they accept the knowledge, they can invest money more.
Yes, that's very clever. And how does the double tight compare to other popular skin tightening devices currently on the market for a clinic owner looking to, expand their toolbox?
Usually, the double tide is made, or we company name is Agnes. We are very good knowledge because we have another machine for the Agnes, and that's a single needle radio frequency using the high temperature. And the double tide, our second device, we're using the lower temperature, lower energy radio frequency, and this is anti-aging, and also with injection function. And so the company who manufactured and invented the machine in the first time in the world, we always get a lot of complaint from other doctor because we are the first. Because then we have to explain all the things. If we copy the machines in exist copy, if we copy the same machine, it is easy because all the doctor they already understand. Double tide, we call the micro needle, but actually it is microblade because if you magnify the needles, they looks polygonal shapes, and that means it's polygonal shapes is they have touched more surface, and then we can apply the more radio frequency energy the contact area. And other the micro needle radio frequency machine, usually the needles in the when they start on, needle is come down and penetrate the skin and they back, and then going down and back. But actually, and if mechanical view, maybe machine cannot be perfect, so they can change a little bit depth, like your cars is when you get a first new one, this car is perfect, but 1 or 2 years later, they make some sneaking sounds. They are loose, right? So a needle can be unstable. I believe it's unstable depth. That is why we decide the fixed depth and the fully contact, not movable needle, because we want to focus exactly papillary dummies and the reticular dummies. And then we just fix the needles and the penetrate, and the tip of the needles, they have exactly generated radio frequency for exactly target zone. We don't want to scatter the energy. That is difference.
Yes. So, with the growing demand in
Mhm.
non-surgical options, do you see
Mhm.
the double type becoming a game changer in the industry?
Uh, at first, double tight, of course, we invented a machine for the face, and then we tried the neck, and then maybe the double tight apply all the skin. I mean, the all the skin. So some Korean doctor they try to using the double tight for the by a gynecologist, and also the company we also depending on the doctor's demand, we will change all the needle design for the purpose. Mhm. And I don't know about the Australian market, but in Korean market, the patient there, they are very feel important, hands and foot. We can try. I'll do.
I think it's going to do amazing. And
Uh-huh.
are there any risks?
Risk, yes, of course, it's a general risk. First we using the needle, so we penetrate to the skin. So maybe if you perfectly prepared, maybe a infection, but that is easy to control. And also needle. Actually, the length of needles of double tight it not cause a lot of bleeding, but sometimes it's a small bruise can be happen. But it is gone within 1 week, so that's not a severe complication. And just before I told you, we have two machines, Agnes and double tight. In the agonist, they need quite a little bit doctor skill. So I always explain to my friend doctors is agonist is Ferrari and the double type is Tesla. It is autopilot. That means it's the company we hoped many doctors use. So we make it more doctor friendly, more easily used. But
Yes.
don't forget, even the Tesla, you have to hold the handle.
Yeah. So, is there any specific training or considerations practitioners should have or keep in mind if
Mhm.
they're going to be adopting this technology into their clinic?
Maybe it's just, maybe there are some time to. I think it will take a 1 day to training their steps of putting the syringe into the machine. And well, I think this distributor they will training well, and also the specific trainings is no need. It's just to follow, and then already I ask it the three things. First, stretching the skin, and it is handpiece, stamping. Mhm. That's all. But I promise is a distributor Australia is maybe if I have chance to visit Australia next time, I spare my days to visit each our doctor to visit their clinic, and then if anything miss, I will do the one by one training. I promise.
And Nando's for lunch.
Yeah.
You make it sound really easy. Do you do the double tight or have you performed double tight in combination with other treatments?
Yeah, of course. It's the for example, in the first I told you, it's maybe
Mm.
under 3.0 millimeters. This HIFU can be a very very good option. So for me, I do the HIFU first, and then I do the double tite. Same time, same day.
And how long? So there's some clients here in Australia who want a treatment that doesn't cost too much money. They want
Mhm,
an instant result. They want the
mhm,
result to be dramatic,
mhm,
and they also want it to look natural. So,
mhm.
can you wear makeup after the treatment? And how long do you have to, cover up and hide for?
Yes, it's the I think it's everywhere the patient is very they are always excited to the result, the quick result. So as my tricks is most of the patient's satisfaction from shining from the exact treatment. So usually I always combine with the hyaluronic acid injection because in hyaluronic acid they make a face is bright because in the papillary dermis rejuvenation it will take a time maybe 3 weeks. So 3 weeks is very short time for doctors but a long time for the patient. So if you combine with the hyaluronic acid injection, immediately hyaluronic acid they have an effect and make it your face is bright, and then patient trust doctors, and then they make some more doctors patients trustability, and then they will come back in the second session. When they got a second session, already the papillary dermis rejuvenation start.
Yes. So on the obviously you're talking about injecting, but you did mention and speak a little bit about using vibration
Yes, yes.
on the weekend. Can you explain that to us?
Okay, just we before I talk about the vibration, we have think about the drug delivery system. Okay, and a drug delivery system is very simple. How we give a drug to the target area. Mhm. So the general doctor they give a IV injection, IM injection, intramuscular injection. This and because of the general medicines, is all the doctors injection is the best way to the drug delivery system. But sometimes we can find another way. For example, there are so many great quality of the skin booster or some perfect serums, but they are not medicine, so they are not non-injectable. Okay, yes. So and unfortunately, skin is quite a barrier, so it is not easy to penetrate. But we already make a hole by a microblade, so that means we open the channels. And for example, so when I was last week in the Australia, I heard about some doctor talking about exosome. Actually, exosome is smaller than skin pore size, very smaller than skin pore. So exosome, it is no need to the drug delivery, just topical on skin. It is smaller than skin pore. They are penetrate in the skin pore. But other medicine is larger than skin pore, but we make a hole and then we topically approve. Yeah, topically approve, it is okay, but it takes time. We want to push. We want to push into the more. Yeah, you go in, you go in. That's why we have. So that is why using the vibration. All the vibration use all medicine. For example, so some your therapist they do some non-injectable skin booster, non-injectable serum. When they do skin treat, they can using the vibration to absorb. It work.
Wow, that's it's incredible what you can do with where we've come over the last 10 years. What do you see in the future for skin tightening? Any exciting innovations or where do you see this progressing to in the next 10 years?
Uh, uh, I involved some it's kind of not I couldn't find the final product yet, but I now in the researching in the almost finish, and I believe within this year's I can get in the CE and FDA approved. This is Rickit. and then just the marolo and make a hole, and we apply for the liquid in absorbed in the skin, and then in skin temperature, this liquid change the gel state. You got it?
Right. Can you explain that a little bit more?
Okay, this is the liquid state
Yep.
product, and then we apply for the skin, and
Yes.
when they penetrate into the skin, and they contact the skin temperature, body
Okay.
temperature, and then or surrounding the body temperature, the liquid change into the gel, and then they have gel state, semi-solid state, and then they have a volumizing and tightening effect. And I'm very lovely to needling. So, and also, yeah, uh, as a cosmetic surgeon for the last 20 years, for me, it's surgical. Yes, surgical is good, immediately effect. But surgical is one way. There's no exit. But non-invasive, more repeatables, and because we are humans, so we can make some errors, and then we have another chance to try it again. So I believe it's more the non-invasive treatment and the less non-invasive. That means the less pain and the less downtime will be come to the market. And also, I believe it's maybe medical things and home care thing. They are more joined, and the customer they can treat their face even in the home. Uh-huh.
Wow, that would be incredible. I can't even imagine. And I feel like that was a great segue to the importance of pre-treatment care and
Yeah, home
post-treatment
care.
care.
Yeah.
Would you ever, if you're operating on a patient,
Mhm.
for instance, doing a lower facelift or something, would you do this treatment whilst they're under anesthetic?
Yeah.
And that's,
And
oh wow, that's exciting, isn't it, for surgeons and doctors because they can obviously use the device in the clinic and then of course in theatre.
mhm. And double tight is that is also a non-invasive way. I prefer the non-invasive way because in the surgical theater is kind of the castle for the surgeon. But
Mm.
there are so many doctors, it's cosmetic doctors and the general practitioner, dermatologist. We hope to, using the machines is without a surgical theater,
Yes,
more easier environment. Yes.
yes. So what advice would you give to practitioners considering investing in a double type device?
Double tight is at first they can not easily understand because it's a first in the world. Mhm. And also, as a customers, I always ask a company, we need more promotion, we need more advertisement. But this company is never, because we just focus on the developing the new techniques. So, but without advertisement, this company survived more than 15 years. Last history prove the quality of the machine. And also, I always advise doctors, there is no exist the best machine in the world, but there exists a better machine. It means the please decide the company or please buy the machines. Which company always give a new protocol. Some machine company they just give the protocol, never change because they never study. So just if you have a large candidate of the machine to buy, just look at their history, how their protocol is changed. If their protocol is changed and then a lot of protocol change for the last few years, that means it's a company will try and error and share the new protocol for the doctors. That means that is better machine because it is improved.
So true. I've never even thought of that, but you're
Uh-huh.
so right. Obviously, they're investing a lot in the research and development,
Uh-huh.
which is so important, and continuous improvement. I mean, which is something that everybody learns when they're doing medicine, about reflective practice and continually improving. So, you're right. That's such an important consideration that's, I think, sometimes overlooked because we get blinded by the marketing.
Yeah, because in the for examples is the double tide is new machine for the last 2 years. Our agonist is started marketing 15 years. And we first start by acne, and then we extended the indication to selingoma, and then we extended the double chins. Now is brow lifting, eyebrow lifting, because we always extend our indication. This means it's the company doctors we study and try, and other doctors using the brain, smart brain, and then we talk discussion, and we extended our the indication, and we shared all information, all of our customers.
That's fantastic. And for a clinic owner or a patient who would like to learn more about the double
Mhm,
tite or
mhm.
reach out to you, how do they do that?
Actually, I'm really happy to accept any inquiry from doctor. And we have a beautiful distributor in Australia, Beauty Technology. And I know the pills, he's very, very energetic, and he always send me the WhatsApp. And June, some doctors got inquiries. I immediately repeat. And if anybody want to or anybody want personally visit chance to visit Korea, please contact me. I open my clinic fully, and we can see. And my email is junegmail.com, and I will always happy waiting for the inquiry. But please, the beauty technologies first.
Fantastic. Well, I know Dr. Cosima and Phil, and they are absolutely amazing. So
Yeah.
I'm sure if anybody reaches out to them, they'll definitely put them in contact with you, or they will obviously answer any questions or concerns that they have. But
Uh-huh.
it's been so fantastic to speak to you today, and it is such a phenomenal device, and you're such a warm, welcoming um, KOL. It's, offering for visits in South Korea and offering to come out and have Nando's and visit clinics here. It's fantastic that you offer so much support.
Yes, I'm really loves. I'm really hope to visit Australia again. Don't forget, if just invite all doctors clinic. We can do 1 or 2 hours together. We can share our own experience. We can study together. Don't forget Nando's.
Absolutely. Well, we can't wait to have you back.
Yeah.
See you again soon. Thank you again for your time today.
Okay.